So hi friends, welcome to the second episode of Samajh Rato SKR, and today we are talking about all the things that can cause trismus, okay, or reduced mouth opening. Now in both NEET and INI, a lot of questions are asked on the reasons of reduced mouth opening, okay. They may be direct questions or they may give you a clinical scenario and you might have to answer based on your understanding of the causes of trismus or what is the cause of reduced mouth opening. जब भी हमें कोई पेशेंट दिखता है with reduced mouth opening, we think ankylosis, TMJ ankylosis. That's not always the case, alright? There are a lot of other reasons which can cause trismus or reduced mouth opening, which can take your patient from this to this situation. That is a situation where the mouth opening is reduced. Alright, now let us quickly understand what are the things that help a patient to open his mouth, his or her mouth, okay? First is his brain. His brain should give a signal, please open your mouth. So a patient should be normal, conscious oriented to open his mouth. Alright? An unconscious patient will not open his mouth. A comatose patient will not open his mouth. A patient who has a low GCS after trauma will not open his mouth. So a patient whose brain is functional normally will open his mouth. If the brain is not functioning normally, that is the first thing you need to open your mouth, right? So first thing is brain. Second thing is oral mucosa. Okay? Any scar, any fibrosis, any banding, any abnormality in oral mucosa can be a cause of reduced mouth opening. So that's the second reason. So whenever you have a question of reduced mouth opening, you start thinking what can be the reasons. Only 4 reasons. Just 4 reasons. Alright, or just 4 sources you can say. Second is oral mucosa. Now third is, what is the other thing which helps in opening of the mouth? The muscles of mastication, right? So masticatory muscles. Okay, not all the facial muscles. No, not the facial muscles. Not the muscles of facial expression. Only the muscles of mastication. What are the muscles of mastication? We all know 4 muscles. Masseter, medial pterygoid, lateral pterygoid and temporalis. Any problems in one or more of these muscles, you will have a trismus. Alright? So that is the third anatomical reason for having trismus. And the fourth reason is bone. Bone including the joint. It can be a simple bone fracture or it can be the joint ankylosis. Alright. So whenever you have a question of that is asking you the reason for reduced mouth opening, first think one of these things is affected. Either it is the brain which is affected because of head injury, because of stroke, because of some tumor in the brain, because of some reason there must be a brain problem. Usually they will not ask you questions relating to brain. Usually they will ask questions relating to the maxillofacial structures. Okay. Second reason is oral mucosa. Is there an areca nut history? Is the patient a chronic pan masala chewer? Is he eating something that can cause fibrosis? Think like that. Third reason is masticatory muscles. Is there a spasm? Masticatory muscle spasm is the commonest reason, the most common reason of trismus, the most common cause of reduced mouth opening, and we will see the causes of it. And the fourth thing is the joint. Alright, now let us list the reasons. Now these are the anatomical sites or the anatomical sites due to which there can be a reduced mouth opening. Now, what can be the exact reason or the exact pathology? We will not talk about the brain because there can be n number of brain reasons which we are not concerned with. We will start with the oral mucosa. And the first thing is oral submucous fibrosis. OSMF or oral submucous fibrosis. Now, we all know that it is caused by areca nut chewing. Okay. Whenever in the question there is areca nut, or tobacco or pan masala which can have areca nut. We all know that it causes, what does it cause? Juxta epithelial fibrosis. Okay? Juxta means just below, under. Epithelial means just below the epithelium there is fibrosis. So what does it cause? It causes formation of fibrous bands wherever you have the oral mucosa, like the buccal mucosa, labial mucosa, palatal mucosa, tongue mucosa. Alright? So this will cause reduced mouth opening. It can cause reduced movement of the tongue. Okay? Because it is a scarring, a fibrosing disease. So that's the first reason. So whenever in the question you have areca net chewing, juxta-epithelial fibrosis, slowly developing reduction in mouth opening, enlarged coronoids, these are all the reasons for reduced mouth opening. Second reason is your muscle of mastication spasm. Anything which causes a spasm. Now what is spasm? Involuntary contraction. Okay, abnormal contraction of the muscle. And what can it be because of? Why will the muscle go into spasm? Trauma. Hit into the muscle, muscle goes into spasm. Internal derangement of the joint, lateral pterygoid goes into spasm. So any of the 4 muscles of mastication, if there is a trauma to them, it will go into spasm, and slowly that spasm will release and the mouth opening will get better. Second very common reason, infection. Infection can very easily cause muscle spasm. Now what kind of infections? We know tetanus. Tetanus causes trismus. We have all read in 3rd year medicine. Local infections. We all know local dental infections like space infections. We have all read about the masseteric space infection. How masseteric space infection can cause trismus due to involvement of the masseter muscle, or submasseteric space infection. How the temporal space infections, if there is some upper third molar which is reaching the infratemporal space, and that infratemporal space is involving the temporalis muscle, it will cause spasm and it will cause reduction in mouth opening. Okay, so spasm, pterygomandibular space infection. So these are the common spaces which are involved in the dental space infections. Masseteric or submasseteric space, temporal, subtemporal, deep temporal spaces involving the temporalis muscle, and pterygomandibular space. Pterygo means involving the pterygoids, middle pterygoid and lateral pterygoid. Pterygomandibular space. So whenever you give an inferior alveolar nerve block, you give it in the pterygomandibular space. And if your needle is infected, if you carry your infection to the pterygomandibular space, you can cause spasm of the pterygoids and trismus. So that is why after an injection of local anesthetic also, there may be reduced mouth opening. Not because of your procedure, because of that LA. Because of that needle which was either infected or it go and hit the middle pterygoid abnormally and it is causing a spasm of the masticatory muscle and causing trismus. So that is the second reason. Third reason can be any foreign body. Any foreign body which is abnormally lying there, like calcinosis, like any calcifications within the muscle, or a trauma causing a glass particle or some foreign body or a gun bullet lodging into the muscle, which will also cause trismus. Okay, neurocystic sarcosis. Now it's an infection, but it will cause formation of a mass within the muscle, an infected mass. So any foreign body, any infection which can cause spasm of the masticatory muscle is one of the commonest causes of acute trismus, of acute. 3 days back he was normal. Now suddenly in 3 days his mouth opening is reduced. Will that happen with OSMF? No. In OSMF it will happen slowly. Whereas in muscle spasm, it will happen acutely, quickly. So that's the second reason. Third reason is radiation. What does radiation do? Again, radiation will do fibrosis. Fibrosis of what? Of both mucosa and muscle. So there will be scarring, there will be fibrosis of both the muscle and mucosa. So radiation is another, any patient who has squamous cell carcinoma or any cancer of the maxillofacial region, parotid cancer or mandibular cancer, and he has to undergo surgery for radiation or only radiation, he will also have fibrosis, and slowly radiation mucositis followed by radiation trismus. So that's the third reason. Fourth reason, so we have seen the reasons from oral mucosa. the reason from muscles of mastication, the reason from mucosa plus muscle. The fourth reason is from the bone, that is fracture. When there is any fracture of maxilla or mandible, or for that matter any facial bone, there can be trismus. Now why will there be trismus because of fracture? Because of pain. The patient will not want to open his mouth, because if there is a parasymphysis fracture of the mandible, he is trying to open his mouth, that is moving the fracture and that is causing pain. So that is also a very important reason of pseudo-ankylosis or pseudo-trismus. Actually the mouth opening is normal. Mouth opening is not reduced. The patient is not voluntarily opening his mouth. वो जानबूझ के मुंह नहीं खोल रहा है, because whenever he is opening the mouth, he is having pain. Will that happen with a zygoma fracture? Maybe not, because zygoma doesn't involve mouth opening. Will that happen with a parasymphysis fracture? Yes. Will that happen with an angle fracture? Yes. Will that happen with a condylar fracture? Definitely yes. So most commonly in condylar fractures, whenever the patient is trying to open the mouth, there is pain because of movement of the segments, the fractured segments, and that pain is causing trismus. That pain is causing reduction in mouth opening. So that is the reason for reduced mouth opening in a fracture. Not an actual reduction in mouth opening, but more because of pain. And last but not the least, we know the last reason from bone is temporomandibular joint ankylosis. That is an abnormal fusion of the mandibular condyle with the skull base, with the glenoid fossa of the temporal bone. Okay, we all know it can be fibrous ankylosis, which is Sony stage 1, or it can be a bony ankylosis, which is Sony stage 2, 3 and 4. Alright, so these are the mucosa related, muscle related and bone related causes of reduced mouth opening. And which of these will be acute? This will be acute. Suddenly there is reduction of mouth opening. That means there is some problem with the muscles of mastication. OSMF will develop slowly over a period of time. Radiation fibrosis will develop slowly over a period of time, and there will be a history of radiation. Fracture, yes, fracture can cause acute problems. Fracture will cause suddenly. Obviously, fracture तो आपको पता ही है, दिख रहा है. भाई कल तक mouth opening was normal. Today there is a fracture because of pain. There is reduction in mouth opening. So obviously there will be an acute reduction. And ankylosis, TMJ ankylosis, does it happen suddenly or does it evolve slowly? It evolves slowly. So today mouth opening is normal. The child had an injury. There is bleeding into the joint. Slowly, that blood organizes into bone, and slowly there is a reduction in mouth opening. So remember, only two causes of acute reduction in mouth opening, mainly spasm of the masticatory muscle and a fracture in the bone. All the other causes are slowly developing causes, and according to this, you can answer your question. Alright, so these are the causes of trismus. If you want a PDF of this file, just write PDF trismus in the message, in the chat box, and we will be sharing you a PDF of this file. Alright, all the best everybody. I hope you don't make any answers wrong from the causes of reduced mouth opening in your NEET and INI exams. All the best.